Qaelon Medical is focused on the number one problem that surgeons, whether they're doing laparoscopic surgery, robotic surgery, or endoscopy, the number one thing they worry about when operating in the GI tract, and that's a surgical leak, which is devastating for the patient, costs billions of dollars to take care of those patients. We are focused on providing definitive leak detection so that before a patient leaves the operating room or the GI suite, we know whether or not there's a leak, because then the surgeon or endoscopist can take action right away. Surgical leaks are the most devastating clinical complication for GI surgery. If you have colorectal surgery, for example, 18% of those patients could have a leak. And of the ones that have a leak in the first 5 to 7 days, 18% of those patients die. 86% of them have another painful surgical operation before they've even recovered from the first one. If they're being treated for cancer, cancer comes back twice as often. And most devastating at all for the patient when it comes to a quality of life, following a GI surgery, you will have a stoma or an ileostomy, where you empty your bowel contents 3 or more times a day into a plastic bag. So as part of colorectal surgery, that happens for 1 in 10 patients, where the rest of their life, they have an ileostomy or a colostomy. When you have an early surgical leak, that number goes up to 46%, which is devastating for those patients. It changes the quality of life, not to mention the other complications that go with having to do that every single day. Surgeons today do everything they can to avoid a surgical leak. They are very careful about their anastomosis. They look for perfect perfusion, perfect placement of their stapler. They do everything they can to make sure that the procedure itself is very successful. Unfortunately, they don't have a lot of tools to actually detect and confirm the integrity of their anastomosis. They use a technique that started in 1910. Dr. Kreil, who was the founder of the Cleveland Clinic, was the first one to report on doing an air bubble test for a leak in the bowel. That's over 100 years ago. So we have surgical robots, we have gene therapies that are targeted to patients' DNA, we have cameras that can detect abnormal tissue, but we use the same method that we do to check a bike tire and see if there's a leak there. It's not accurate, it's analog, and it's very unreliable. So today, surgeons, when they're checking for a leak, they fill the pelvis with saline, they inflate the rectum with air, and they push the bowel underneath water, and if there's a leak, they hope to see bubbles. Unfortunately, this test is unreliable for a number of reasons. Most importantly, the pressure that's in the rectum, if it's not high enough, and the pressure in the abdomen is higher, even if you had a gaping hole in the intestine, you won't have a pressure gradient that will allow the air to flow and create bubbles. Or when you push the anastomosis underneath the saline in the pelvis, you could grasp the very area that the leak has occurred and push that against the pelvic wall or in the instrument itself, and you could hide the leak from yourself. We bring definitive information. We quantify it, and in 30 seconds or less, you can confirm that you have a leak, even if it's as small as 1 millimeter, which is the size of one staple. The Qaelon platform works on very simple principles. We measure gas concentrations in the abdomen after surgery. And so the organ would be inflated with room air, and the operative environment is full of CO2. We measure precisely the concentration of oxygen and CO2. And when the atmosphere changes from 100% CO2 to any concentration of oxygen, once it goes above a threshold level, we can confirm that there is a definitive leak. We were inspired by a surgical procedure that our founder, Eran Shlomovitz, he was working with Lee Swanstrom, a known innovator and probably one of the most prolific innovative surgeons in the world. Eran was Lee's fellow. They were doing a complicated GI procedure. And at the end of the procedure, they couldn't confirm whether or not there was a leak and whether there was integrity in the bowel. So they actually had to take the patient from the GI suite to the operating room and perform a laparoscopic procedure to make sure that their first procedure was effective. And Imran said, this is crazy. We should be able to test at the end of a procedure and definitively know whether or not there's a leak in the bowel. And that's the starting point for where Qaelon came from. We are a spin-out of IHU in Strasbourg, France. We started there like many new technologies that were spun out of the hospital, and now we're accessing the French system for innovation, which provides great opportunities for non-dilutive grants as well as support for the efforts that we're making to develop the technology. We are starting with the US market with the FDA. We think that is the fastest pathway to revenue and clearances. We were also accepted into the Safer Technology Program by FDA late last year, which means they believe our technology brings additional safety to the surgical market. So we'll start there and then continue on to the notified bodies into Europe with CE clearance. Qaelon is differentiating itself in two ways. First, we are the first and the only leak detection platform in the world. And we're based on a very simple technology, which is insufflation. And so we bring leak detection capabilities to every surgeon, endoscopist, thoracic surgeon as well. Meanwhile, we have a state-of-the-art insufflator, and insufflators are used in 37 million procedures every year. We bring that insufflation and a state-of-the-art insufflator for those procedures. So a surgeon not only can check for leaks in the applicable procedures, which are about 2.6 million, but in all of the procedures, insufflation is becoming a technology that you have to have. More recently, you saw Intuitive launch an insufflator with their Da Vinci 5. That told the world that insufflation is part of the robotic system. It's part of the surgical system, not unlike a vision system, because with great insufflation, you have great vision, you have a stable operating platform, and you can do new procedures. In endoscopy, where advanced procedures are taking off, insufflation is starting to be used much more prevalently there. So when you think about endobariatrics, the treatment for obesity, for diabetes, for NASH surgery, these are advanced endoscopic procedures that are going to demand insufflation. Oh, and by the way, they'll want to check the leak and check the integrity of their work at the end of the procedure as well. So we're not going to stop at having a leak detection system. We already have developed IP and a prototype around what we call a sniffer, which is a wand or an instrument that would precisely locate where the leak is. Beyond that is navigational capabilities that are tuned into that wand to where you could attach it to a robot and the robot arm could move to the precise location of the leak itself. We also have a platform that can integrate with other sources of data. And what we're developing is what we call an anastomotic stress test, which would integrate ICG or other visual means of analyzing perfusion. When you combine those two technologies, you actually have the ability to test an anastomosis under anatomical conditions, with food moving through the intestine, with blood pressure changes and things like that. So for the first time, we can quantify perfusion and define and confirm if there's a leak present. Qaelon right now has finished their prototype work. We have a high-performing prototype that can detect tiny leaks, a 1 millimeter leak, which is about the size of one staple, and we can detect that in 30 seconds. So we finished our prototype work. We're doing fundraising now, and with that money, we will use the proceeds to take the product into development, regulatory, and through the FDA and eventually CE clearance. We believe that's a 24-month timeline. So the milestones that we are achieving and focused on right now, first and foremost, is raising the funds we need to take the product through regulatory clearance. So we're raising $6 million right now, and with that will come an additional $3 million in non-dilutive grants and low-interest loans. We believe that will get us well through FDA clearance, as well as the CE filing, putting that together, and continuing to build around our IP. We're very excited about the IP portfolio that we have already. We have 3 patents. We just received one for Japan, and we have other patent families that we are working on our sniffer or localization technology, as well as the anastomotic stress test. And so those are our 2 main milestones. So while we are bringing a new technology to the market and a new capability with leak detection, we're also excited about bringing differentiation to the insufflator market. This is a very large market. There hasn't been a lot of innovation in the last 10 years for insufflators. And we know that with our insufflator, it's a constant pressure insufflator. It brings a steady visual platform to conduct surgery. And we know that's differentiated. We know that surgeons want innovation in insufflation. We also believe that our value to strategics is dramatic in that many of them have insufflation platforms. They're tucked into their video towers, and mainly those companies compete on the state-of-the-art visualization. Their 4K, 5K, incredible visualization, some of the technologies that actually detect abnormal tissue with the camera. We bring a differentiation to the tower to where it's not only the camera now and the visualization system that can differentiate their tower, it's also insufflation. Because if you have leak detection and no one else has it, you bring something that surgeons want and that they don't have right now. We are on a mission. We believe our mission, first and foremost, is to change surgery and improve the outcomes that surgeons can achieve. We feel strongly that surgeons are doing everything that they can to achieve great outcomes. They're using the tools they have, and we believe that our technology, our platform, will give them a capability that they've never had before, and that should translate into better patient outcomes. And of course, with that comes a reduction in healthcare costs and hopefully a fair return for our investors.